I am Walter Gottlieb of the National Committee to Preserve Social Security and Medicare. I am here talking to our senior healthcare expert, Ann Montgomery, about the big, beautiful bill that House Republicans passed last night with President Trump's blessing. We call it the unfair, ugly bill. And Ann is going to help us understand why. Now, Ann, you have called this the biggest attack on Medicaid in the program's nearly 60-year history. Can you explain why?
Yes, Medicaid is the largest healthcare program in the country, enrolling and covering more than 70 million people, and it's essential to the healthcare system. And yet, there is seemingly not a recognition of how important Medicaid is to millions and millions of people and to providers that provide services and to the overall healthcare system. Because the GOP led Congress in the House of Representatives is proposing to take more than $700 billion out of Medicaid over a decade. That has never happened before. It is going to result in millions of people being uninsured and not being able to afford likely coverage from another source. And it's going to force the closure or downsizing of hospitals, clinics, and things that people really count on. It will have a massive workforce impact as a result. Providers cannot provide services for free. And ultimately, it will really hurt state economies because those job losses will bring in less revenue. There's a real cascading effect, and this is bad news.
We know that it's going to hurt voters and constituents in red states probably just as hard, if not harder, than in blue states that may be more flushed with cash. 1 in 5 Americans depends on Medicare for basic health coverage, including 8 million seniors. Can you tell us who are these folks that are on Medicaid so we understand who's being hurt?
Well, in terms of older adults, there are a lot of older adults who are on Medicaid. They're low income. And once they reach the age of Medicare eligibility at 65, then they're duly eligible. And there are, as you point out, millions of those folks. I think it's about 13 million or so. And if it becomes harder, which it will become harder if this bill that just passed the House does become law, to enroll in Medicaid, then it's going to be very difficult for people to access, who are older adults, their Medicare benefits because Medicaid pays their copays, their deductibles, and so on, precisely in order to allow their access into Medicare and to receive health care services through Medicare. And there's going to be a real blow, I think, to low income older adults in that way. The programs are all linked together, and that's something that people don't necessarily think about. There's something
But
called the
can I
Medicare.
ask you about,
Oh, sure.
can I ask, sorry to cut in, can I just ask you about this part of it, zoom in on this
Mhm.
part? So Medicaid itself, independent of Medicare, covers 60% of long-term care services and supports. So how could that hurt seniors, that Medicaid squeeze?
Yes. Okay. So long-term care is basically resides in Medicaid. We don't have long-term care to any real extent in the Medicare program. We have some post-hospital skilled nursing facility services that are limited in duration and cost beneficiaries a reasonable amount of money. But if you need ongoing supportive services in long-term care for months or years at a time, then in order to qualify for anything through public funding, you pretty much have to, enroll in Medicaid. And currently, the mandatory or the regular benefit for long-term care in Medicaid is a nursing home. So you're pretty well guaranteed a nursing home placement if you qualify for Medicaid. You are not guaranteed to be able to stay at home and receive home and community-based services. And that's what more than 90% of the population that needs long-term care really wants. They do not want to move to a nursing home. They much prefer to stay at home. Those home and community-based services are going to be devastated under this GOP reconciliation package because states are not going to be able to afford to provide those services which are not required. They are optional services and they will be cut deeply.
Was there also something in the bill about the equity that seniors have in their homes? counting toward their income when they apply for Medicaid, meaning they have to get rid of their houses or their houses count against them? Because it didn't used to be like that.
There has been a home equity limit in Medicaid before. It's been set at 750,000. So if your house, which is normally exempt your primary residence from being taken into account when you apply for Medicaid and you need long-term care, if it's 750,000 or less, it will be exempt. But they are raising that in this particular package to $1 million. So that will mean that people who live in higher income areas will have a harder time qualifying for long-term care under Medicaid.
I see. And why is it so unconscionable that they are gutting Medicaid to pay for another tax cut, principally benefiting the wealthy? This seems like reverse Robin Hood incarnate to me.
It is to cut, safety net programs, to cut programs that were created and designed to help working class and middle class people afford decent health care in order to provide more tax cuts and more profits, if you will, to very high income people who clearly don't need them is indeed reverse Robin Hood. And we should rethink that. We should look at the revenue side of the budget and ask people to pay into the systems that we have, including the healthcare systems, as they are able to afford it. And they are much more able to afford it at the high end than they are at the low end. So why would you want to take money and healthcare away from people to provide further tax cuts? It makes absolutely no sense if what you're trying to do is provide a good, stable economic, path forward for most of the country.
And that's why we're calling it the unfair, ugly bill instead of the big, beautiful bill, as Trump likes to call it, because that's what it is. What happens next? And can these massive Medicaid cuts be stopped in the Senate? And how is it looking over there?
That's a good question. I think that the picture will be very different in the Senate than it has been in the House. Senators really have a lot more people to think about, given that they are representing an entire state. And they well know, I think almost all of them, that taking this much money out of Medicaid, which accounts for 18% of all national health expenditures, it's a huge program, is going to really hurt their state economies and is going to result in many, many millions of people who won't have health insurance or health care coverage. They know that. They also know that in rural areas, in particular, hospitals and clinics and providers are much harder to come by. They're much more fragile. Those are going to be the first places that will feel the impact of these very draconian cuts. So there's going to be a lot of negotiation, I would say, and it's already started. I know that the majority leader has already started talking to his Republican colleagues. I certainly hope that he talks to all of his colleagues. And we have seen actually an interesting op-ed in the New York Times fairly recently from Senator Josh Hawley expressing deep concern about the Medicaid cuts, noting how important Medicaid is to his constituents, his Missouri constituents, and really expressing pretty firm opposition to, trying to cut into this particular program in order to finance tax cuts for people who don't need them. We'll see what, comes of that. But it's not just
Josh,
Senator Hawley who's concerned. It's his colleagues in rural states in particular are quite concerned. And I think there's going to be a lot of rethinking of this
they're
House
right to be
package would be
concerned.
my
They're
prediction.
Yeah, they're right to be concerned because voters will hold them accountable if they gut Medicaid. And Josh Hawley certainly is no flaming liberal, to, to be sure. So, best thing you can do out there is to contact your senators and let them know hands off Medicaid. All right. Well, thank you, Ann Montgomery, our senior healthcare expert. We'll be talking to you again soon.
Thank you so much.